to the Rural Social Worker Closing the Gaps Despite the Distance podcast, your compass to the heart of rural landscapes. I'm your host, Andrea Charles, and I invite you to join me in this space where we unravel the vital role of social workers in weaving connections, fostering resilience, and leaving a lasting mark on the fabric of rural life. In each episode, we will navigate the unique challenges faced by social workers in forgotten communities across our nation. From the rolling fields to the tight-knit communities, we will celebrate the triumphs, explore the untold stories, and delve into the transformative impact of those who dedicate themselves to closing the gaps. This podcast serves as a journey, an exploration of the rural social work landscape, where professionals confront adversity, create change, and leave lasting impressions. Together, we'll embark on a mission to understand, appreciate, and amplify the transformative power of social workers in the often overlooked corners of our nation. A quick note, while our discussions provide valuable insights, it's crucial to remember that this podcast is not a substitute for official supervision or guidance in your professional practice. I encourage you to seek the support you need in your professional journey. Get ready to immerse yourselves in the narratives that define rural social work, to be inspired by the dedication of those who navigate the distance to make a difference, and to gain a deeper appreciation for the resilient spirit of rural communities. Welcome to the Rural Social Worker Closing the Gaps Despite the Distance podcast. Let the journey begin. I want to start the series with a land acknowledgement. I humbly acknowledge that I am on the ancestral lands of the Nimiipuu Nez Perce tribe. The Nimiipuu people have cared for and called this land home for countless generations. I express my deep respect and gratitude for their enduring connection to this territory, its waters, and its resources. In recognizing their rich cultural heritage and ongoing contributions, I commit to honoring their sovereignty and traditions. I will strive to approach my podcast with cultural humility, seeking to understand and integrate the wisdom and perspectives of the Nimiipuu community. In doing so, I aim to contribute to the community's well-being while upholding the Nimiipuu people's legacy for countless generations to come. May my actions reflect a commitment to both service and preservation, fostering a future that values and respects the unique cultural identity of the Nimiipuu tribe. Hello, everyone. Andrea here, and thank you for joining me on the very first episode of the Rural Social Worker podcast. The title of this episode is Embracing Challenges, Building Resilience, Social Work in Rural Communities. I am so excited to have you join me. Before we get started, though, I would like to introduce myself and talk a little bit about my social identities. I am a clinical social worker in the rural community of the Lewis-Clark Valley. For those of you who do not know where that is, it is at the mouth of the Hells Canyon on the Idaho-Washington border. We are about 20 miles from the Nez Perce Native American Reservation, which is where I grew up on a farm out in the country, away from everything. I am a white middle-class female with a husband and 2 kids, and am from a Christian background. I believe that both growing up on a Native American reservation and in the farming community has shaped who I am as a person, educator, and clinician. It has allowed me the unique experience of connecting with all types of people, noticing the person first and the differences second. I have learned the value of community and hard work, as well as how to connect within the community and to the community. I am also aware that my background places me in a position to access society's rewards and privileges without facing discrimination based on race, religion, socioeconomic status, education status, mobility, or nationality, and continue to keep that in mind when creating and delivering content on this podcast. The purpose of this podcast is to provide a resource for rural social workers to navigate the unique challenges in rural communities. There is a significant amount of research around the challenges of being in a rural community and working in a rural community. However, there's very little research or resources on how to navigate those challenges. That is where this podcast comes in and bridges the gaps in navigating these challenges specific to rural social work. The hope is to help rural social workers feel connected, less isolated, more confident in navigating difficult situations, and prevent burnout. These are all things that would have helped me when I started my journey as a rural social worker. So let's talk about rural communities, shall we? Okay, let's talk about the general definition of rural communities and what constitutes rural. I also want to talk about the characteristics and dynamics around rural communities, what makes them unique, explore the challenges defining rural areas. So, around 15% of the US population lives in a rural community. Rural communities have higher rates of serious mental illness, they have higher suicide rates, and those are only climbing. And people in rural communities are less likely to seek care, especially around anything related to mental health. Part of that is due to stigma. However, defining what is rural has been a struggle since early service delivery back to at least 1912. Many factors go into deciding what is rural, and it depends on kind of what the purpose is. Is it a federal program? Is it a state program? Is it, just a general program that doesn't have funding stipulations? It can change with all of those. And a lack of a consistent definition has caused a lot of problems for funding purposes when looking at community development, program planning, and implementation of healthcare resources, because financial decisions are based on these inconsistent classifications, which can be so detrimental to service delivery in rural areas because of levels of poverty, limited access to resources, level of crime and abuse, which are all higher in rural communities. The Economic Research Service has a standard definition that I'm going to use for the purposes of my project and this podcast, which is anything less than 50,000 people. Anything less than 2,500 is usually considered frontier, which usually has even lower access to resources. And they usually don't even have doctors or social workers or anything even there. You still have to go into a rural town to get those resources. So I want to talk a little bit about the community that I am from. So we are small. We have probably about, the combined population is 40,000 or so. However, it functions as a much smaller community. And I'm not sure why that is. I think part of it might be because it is a farming community. And so that has some bearing on that. And it functions in a sense of a regular rural community or a smaller community, even smaller than 40,000. In that everybody knows everybody. I always joke that instead of 7 degrees of Kevin Bacon, you get like 2. And so it is an everyday conversation that I'm having with clients where people are coming in and we're talking, and I often will find times where I know somebody they know. And when that happens, then I have to address that. And then we decide where we want to go from there. I've had people, though, who I've seen for like 6 months, and then I find out that I know their daughter. I went to high school with them. And that is a point where I have to figure out, like, what am I going to do? I've had other situations where it's a triangle effect. And so I may be seeing somebody, they may refer somebody to me, and then something happens where their world's a mesh that causes problems. And then I have to decide, who am I going to see and who am I going to keep on my caseload? Because obviously I can't keep them both, because that makes it very difficult. So, other things about my community, like any rural community, getting involved is important, and understanding the kind of where you need to go to get involved. Providers in general in all rural communities are more successful when they understand rural communities and how they operate. Some of the things that I see in our community is mental health is becoming more of a priority, but it's still not where it should be. There's a lot of people who just think, you know what, I don't want to be seen coming and going from a counseling office. I don't want anybody to know I have a mental health disorder. I don't want to be weak or anything like that. And so that has a lot to do with stigma, right? So the other thing too is getting in to see a provider. So we have, I think everywhere in the United States has this, but in rural communities it's more prominent, is we have a lack of
providers providing services, which then makes it difficult for people to get in for services, especially when you are trying to get, like, say you're a doctor and you're trying to get them to get counseling or whatever, and they're finally on board to get counseling. And then you say, okay, well, try this place and try this place. And they're all full. And so that makes it hard, because then they're like, well, forget it. I'm done. I'm not going to do it. And so that plays a role in our community. The other part is, we are very close to the Native American reservation of the Nez Perce tribe, which I talked about a little bit in my land acknowledgement when I started the episode. And so we get a lot of referrals in our office from the tribe. And what I do for my employees that I have is I really help them understand the culture and understand how connecting to culture helps bridge gaps and helps build resilience and helps them just feel better and more grounded in what they're doing. And so what we do is we do that, and we find that it is very helpful for us to know about the Nez Perce tribe and how they function. It's easier, I think, with the tribe because people who grew up here understand more, especially if they grew up out in Lapwai, which I did. And so that helps me, I feel like, connect with them better. And also, I always like to tell people that, that's where I'm from, to help ease their mind, but also to let them know, like, my mom taught out there for, 30 some years, and they need to know that so that they can make a decision of whether they're comfortable seeing me. The big thing in rural communities, at least that I've seen here, is just being very open and honest with the people you're seeing and how your worlds mesh and how they intersect, so that you are better equipped to help them navigate whether they want to see you or whether they want to see a different provider, and not taking it personally if they say, you know what, I want to see a different provider. That's a little bit about my community specifically. I want to talk about, in general, kind of the challenges that exist in rural communities, which in general, there's a lack of access, there's financial barriers, there's stigma, there is a lack of, not only the lack of access does not only come from lack of providers, but also lack of access in the sense that they have to travel great distances to get those services because they just don't exist here. It's not a lack of providers, it's there are no providers. For Washington Medicaid individuals seeking services in our community, they have to travel 2 hours to get a lot of the testing done because there's not a lot of people who do testing and take Medicaid for Washington. I think there's maybe one in Pullman, but there really isn't a lot of access. And then you come across the fact that, can they spend the money to drive 2 hours and back? And can they leave their job? Can they get time off? Can they pay for gas? Do they have a vehicle to even get there? All these things play a role, which makes it so that social workers in rural communities have to have a more generalist practice to support all of their clients' needs. And that can be difficult because it makes it harder to niche down and specialize in rural communities because you have to have that generalist practice. I do find that it's easier in the group practice that I have created. We all have kind of a niche, but yet as a whole, we are serving a lot of different people. And so that helps, I think, a lot in the rural communities, is that I think that's really the only way that you can meet all those needs. If you're an individual practitioner or a social worker that just is on their own, it's harder, especially for clinical social work. And that is specific to clinical social work. So, other social work professions are a little bit different, but you still have that burnout is high because you're maybe the only one, or you are the only, there's maybe 5 of you that are all splitting things. So some of the challenges in rural communities is, like I said before, they have a higher poverty, they're high risk populations, they have higher suicide rates. That gap in suicidality is climbing and becoming higher. And they have more people with disabilities. If you are a social worker in a rural community, there is higher risk for you feeling socially isolated. And oftentimes, if you're a new provider coming into the rural community and you're not from there, there's a lot of times where they have suspicion and mistrust of outsiders. And that even further complicates service delivery because they don't want to see them. So oftentimes, like when I'm referring out, if I have that trust built with a client, I'll be like, you know what, I trust this person. And that's usually what gets them in the door for like testing or for getting services with DSHS, or is connecting them to an individual person that I personally know helps them, And so for other things with rural communities in general, not about providers, but in general, we talked about the lack of access. We talked about transportation issues and stigma. So rural healthcare is significantly underdeveloped and under-resourced, which contributes, again, to the lack of access of care. A lot of providers in rural communities are retiring and new providers are not moving to that area. And so then you have even a bigger gap in care. There was one article that I came across. It was a study that was based in Washington State in the rural communities. And they were talking about how there is a lack of crisis services in rural communities. Oftentimes the providers are providing the crisis services, which then leads to burnout. And these clients are stuck in limbo because there's a shortage of hospital beds. So they're too severe for individual therapy, but they're not bad enough to get into the limited beds. So then this crisis cycle is what it was Beecher et al. In 2016. Talked about this crisis cycle that just continues because they are stuck in this limbo. And in the last 10 years, suicide specifically has been going up, and suicide among farmers in rural communities is double than it is in urban communities. And oftentimes the farmers are the foundation of the rural communities, and they have strong emotional ties to the land. So then their stress is also, it's a ripple effect. They're connected to the land. They have it's a stressful career choice. Their stress is elevated by changes with weather, supply and demand, social isolation, any machinery malfunctions, anything like that. The other thing with rural communities as a provider is oftentimes you have different roles. They talked about, article I read, it was talking about like you wear different hats. And so you may serve on a board with a client, or they may go to your church, or they may go to your church. They may be a parent. I've had parents I've seen that I didn't even know they had kids that were in my kids' class. So there's also that, like you don't even know, and you have a dual relationship. Some other intersecting roles are that maybe if you serve on a board or you're part of a church, then somebody within that may say, hey, I have this person I want to refer to you. And then there's a dual relationship there. And it's a fine line to navigate that, because then they think, well, I refer that person, so I should know more about them. And then confidentiality has to be maintained. And so you have to explain why they do not have access to that information. The other thing on a rural community is understanding the slower pace of things. So sometimes things take longer. Part of that is due to geographic issues. We're spread out more. Services are spread out more. People work different hours. They may work less hours because they are spending more time with family. So some marginalized groups within the community is specifically, high poverty and the Medicaid, Medicare population, or the underinsured or uninsured people. So we are on the border of Idaho and Washington, and in Washington it's a lot easier to get services. It's a lot easier to get on Medicaid and to get the services that are offered from the state. So in Idaho, you have to either be pregnant, a child, dying, or make zero money to get on any services. In Washington, you can own a house, you can own a car, you can have some assets, and you can make close to minimum wage and still be able to access services. And though that include Medicaid, less so. I mean, if you're working 40 hours a work week, minimum wage, You may not be able to access food stamps and such, but definitely more in Washington. But in Idaho, you have a high percentage of underinsured or uninsured individuals who aren't going to seek services because they do not have the insurance that's going to help them pay for it, and they don't have the money to be able to pay for it. You know, we have an integrated health clinic here that serves that population, but I know they have a wait list, and getting in to see them is difficult because we only have one. And there aren't a lot of people who work with Medicaid in general also. So like if I have a client and they're on Medicaid or they have to get on Medicaid, I can no longer see them because we do not take Medicaid. However, I do have interns, and I have people, I have interns. And one thing that I require of all my employees is that they see one pro bono person on their caseload. And so that is how we get around kind of the underinsured or uninsured or Medicare or Medicaid people who are seeking services. Other than that, like if I'm trying to refer them to a counselor, I can count on one hand how many people take Washington Medicaid and will treat them for clinical, if they're a clinical social worker. And that makes it very difficult to refer to people because there's nobody to refer to. And so then I feel like it makes me more of a case manager because I'm trying to help them find the services. That goes true, though, with anything that they're trying to do. If I'm seeing them for counseling and then they need to find a bed manager, or they need psych testing, or they need to get on Medicaid, or they need to talk to DSHS, I become more of a case manager. In an urban community, that doesn't happen. You know, you go in and you see your counselor and then you leave, and they don't really do anything extra for you. In a rural community, we do. And I will have people contact me during the week and ask me to help them with something or ask for advice. And then also there is the level of disclosure that happens in rural communities, which I will talk more about on our episode that talks specifically about the Medicare, Medicaid population and rural. The level of self-disclosure in a rural community is a little bit higher. They need to know who you are. I'm not saying they need to know where your address is or where your kids go to school or their names or anything like that, but they need to know you're human. I was listening to this podcast. It was on Clearly or Light Up the Couch podcast. And it was an episode that was talking about the Indigenous perspective and how, as social workers or counselors or whatever role we have as a provider, we need to lower the wall between us and the client. We need to be more personable, we need to be more approachable, and we need to be able to access that. And so it's important to know how to do that appropriately. So, like I said, though, you're not going to tell them where you live, what your kids' names are, your husband's name or wife or spouse or partner or whatever. You're not going to tell them that information. But, telling them that maybe you struggle with anxiety as well, or you have in the past, or you struggle with these different things, that helps you be more human. And it helps lower that wall like that podcast was talking about. It also helps you be more relatable, and relational therapy in rural communities is more effective because they want to know you. They want to know your people. They want to know where you come from, what you do. That's what makes them comfortable coming to see you. And that's what also helps you be accepted in the community, is being open about who you are and getting involved in those communities. So, and that is more true with marginalized populations than it is with other populations. So there's a lot of intersectionality that exists in marginalized populations. They are dealing with poverty. They may be dealing with racism, discrimination. They may be dealing with difficulty finding a job. They may be having difficulty with family dynamics. There's so many different struggles that have to do with marginalized groups in rural communities. Marginalized groups and people in general in rural communities, like I stated before, are less likely to seek mental health services than those who live in a rural or in an urban community. Part of that is they don't trust mental health providers. They don't believe that a stranger could help them. And It also, a huge concern is that social workers in rural communities, people believe that they should be able to handle their own inner struggle and avoid involving others in personal issues. So then they're not going to open up to you. That is where disclosure helps, getting them to bridge that gap, building that trust. Self-disclosure is a tool, and it has to be used correctly. So one study that was based on, it was through the eyes of patients and their families, and they were all from areas with a population of 50,000 or less. And they talked about the big 5 main themes that emerged from that research done by Robinson et al. In 2012, is that mental health problems are accompanied by significant stigma. Practical challenges hinder the access to mental health care. Solutions to mental health concerns are frequently inadequate. Mental health problems are often unresolved. And then lastly, rural patients and family members frequently pursue their own solutions. And there may not be solutions that are effective. But another thing to think about in rural communities, though, because they do often solve their own problems, the level of resourcefulness and resiliency in rural communities is high. They have the ability to come up with creative solutions, and they often can go through a lot more before they finally need to get into for help. Another part of that is, the marginalized populations, they have a huge financial barrier. So they have to travel to appointments, and then that costs money, not only related to travel, but like I said, also taking time off work, and then they lose wages. And then that's a financial strain for their family. And it's just this trickle down effect. And insurance companies have so many limitations. So even if they are insured, they don't always, especially mental health, they don't cover a lot of the services. And then the financial burden is then on the client. Now, providers in rural areas, there is a frustration there. It's a different type of frustration because they're not dealing with the issues firsthand, but they're watching their clients go through it. And it puts a strain on providers, and then often forcing them to work outside their scope of practice because they're trying to solve all the problems for their clients. This leads to higher burnout in rural communities, and social workers in rural communities are often working with more people with severe and persistent mental health problems. And they are trained on the urban model, making it difficult to connect with their rural communities that they live in. And then in addition to that, if they're practicing outside their scope of practice, then that's where burnout comes in, because they're doing too much. They're burning the candle at both ends. And one of the studies that I looked at that talked about providers it talked about that there was a lack of education around rural communities. There was a lack of training around policy and practice, and the needs and opportunities that exist in rural communities. There was a huge need for small town knowledge and connections within those people working in rural communities. And again, they have to practice from that generalist perspective more often in rural communities, and be competent in crisis evaluation and management because there's such a lack of crisis services. The other thing that providers come across is I come across this and I have to make a decision, is people can't pay for services. Even if they have insurance, like the copay can be too much. And so what do you do? Because you as a social worker or as a provider, that you have to make money. And so how do you make money and provide services and not make it about the money? And also not leaving these clients just out there because they can't afford services. And, there's a lack of providers, then who do you refer to if they can't afford you? Who do they go to? Oftentimes there is no one. And then there's also the financial issues that the providers themselves are facing. Another study I came across that talked about how 60% of rural providers that work and live in rural communities are trying to get loan repayment. And so they're only coming to rural communities for that loan repayment programs. And then when their loans are paid off, they don't stay, which then leaves a care deficit. This affects retention. This affects clients. This affects the access to anything. It makes it difficult for, again, people to find services. Now, if those people come to the rural communities and say they stay, they get their loan repayment, but if they understand how to function in it, sometimes they learn to love it, and then the turnover rates can go down. Take that out. There's no research for that. In general, when providers are in rural communities, they're more successful if they understand how those communities function. And so that also reduces turnover rates because the expectations are known. And so they're more likely to know what to expect, and then they can accept it. The other thing that can help with that retention and burnout and all of that stuff is quality supervision within rural communities, which there's a whole episode for that later on in the season. The other thing, is the salary in rural communities is often lower for providers. And so that is often why they also leave and go find jobs in urban areas. Advocacy and policy. Now, advocacy is going to be its own episode also later on in the podcast, but I want to go over that and the social justice part specifically. So, as we all know as social workers, social justice is a core value that is guiding social workers in practice according to the NASW Code of Ethics. The goal is for social workers to promote positive societal changes, particularly advocating for vulnerable and oppressed individuals and groups. This is done more in rural communities because you have the idea of you are doing more of a generalist practice, so you are advocating more for your clients. Social justice in a larger perspective in rural communities pose different problems than those that exist in urban. So due to the size of rural communities, there's greater opportunity for a social worker to be judged based on their actions, which can disrupt the functioning of the community. So for example, a social justice issue in a rural community that would not exist in an urban community is simply having a bumper sticker on a social worker's car that shows what political party they support. This damages future social justice advocacy since everyone in town can see that bumper sticker. And if the community disagrees with the provider's stance on those political issues, it creates isolation, the appearance of bias. It can cause you difficulty getting clients in the future, a loss of clients potentially. And so it's important when looking at social justice and advocacy is to understand the needs of the community, how it's best to serve that community, and how also being accepted as a provider and expert in any particular area is important. So I talked a lot about the differences or the things that exist in rural communities that do not exist in urban communities. And I just want to say that, if you are a provider that's in a rural community and you are feeling isolated, I'm hoping this podcast helps you feel less isolated. I also am hoping that maybe identifying the challenges and understanding those challenges, you feel less alone. I know that when I first started, it would have been very helpful to understand the dynamics of a rural community. Even though I grew up in one, I grew up here. I still struggled with, it's a different type of struggle. So one thing I struggled with, instead of coming from, living in an urban community, then working in a rural community, I was in a rural community trying to become a provider in a rural community, a social worker in a rural community. And that was hard because I had to draw boundaries that I didn't have to draw before. And that was necessary for me to have that professional persona. So understanding what the dynamics in a rural community are help. Now, there's also the idea that, and this will be also in a different episode in more detail, is education. So as a social worker, the education is not there oftentimes in a lot of the programs to talk about the nuances and challenges in rural communities and how to navigate those. So then, a lot of these programs are online now. So you have people from all over the country and world doing these programs online. coming from all different types of communities. And online, is not addressing the unique challenges in the communities that the students live. So having to do that more and identify what those are is hard and it's a job of the social worker at that point, because the education is lacking and they're not learning how to navigate these. One thing to keep in mind is it is easy to get burnout in this field. Social workers have high levels of burnout in general, and burnout and compassion fatigue will be its own episode in and of itself as well. However, I want to say that it is important to make sure you are taking care of yourself, that you are not taking on too much, that you have someone you can talk to, somebody who can bounce ideas off of, to prevent isolation and burnout. Isolation leads to burnout because you feel so alone and you feel like there's nobody to talk to. So even if it is your own therapist, you're obviously not talking about your clients, but if you talk to a therapist yourself, that also helps you feel less alone in general. So I want to make sure that you feel supported, which is the goal of this podcast. The other issue that I want to just touch on before we end the episode here today is ethical issues and dual relationships and boundaries in rural communities differ, and that will be its whole episode in and of itself, but I just want to do a quick touch base on that one. So ethical issues are different in rural communities because of the differences between the communities themselves. So because you are part of the community when you live and work in a rural community, whereas in an urban community, there's no obligation to be part of the community. That poses ethical dilemmas or boundary issues, dual relationships. And there is no model that tells us how to navigate these when you work in a rural community, which makes it difficult. And like I said, they're often viewed differently in rural communities. And in one study, rural providers stated that dual relationships are perceived as more ethical than they would be viewed by providers in urban communities. And that is because of the boundaries within the relationships. So, for example, like gifts is a big one. If a client gives me a gift, typically they're not high value. And I think, what is the harm in accepting the gift? Is it going to damage the relationship if I don't accept this gift? Or is it not that big a deal? So one thing that I do in my practice to kind of help the ethical perspective on this is I usually accept the gift unless it is a large monetary value or something that I feel like is not appropriate to accept. But what I do is I put it in the office. So one, that client always sees it when they come in. I had this lady who brought me a little sign for something. We turned it into a sign for a flower pot in the back. And so it's right by the door. I have other people who brought me like a coffee mug or something like that. And so I just put it in the office. And that allows them to see it, but then it also doesn't damage the relationship because I didn't reject the gift. Gift giving can be difficult to navigate. And so knowing what you're going to do, having a plan, like I don't ever take anything home. I feel like that's a boundary crossing for me. So the other thing is in rural communities is that a lot of the dual relationships that exist in rural communities are not posing an ethical issue. So it's like maybe they go to the same church, maybe they're on like I said before, a board, or a parent. So I'm on the marching band board for the local high school. And sometimes there are parents or relatives of people that may come into the office. And so those don't necessarily pose a problem to the relationship. It's all about disclosure. Like, are you telling the client that this dual relationship exists? And because relationships are so important in rural communities, it's possible that the provider focuses more on the relationship and the effects of their actions on the relationship, rather only on dual relationship. Sometimes and oftentimes in rural communities, they are unavoidable. You cannot avoid dual relationships. And that is another thing that education is lacking because they're not teaching about rural communities, they're not preparing providers to face the ethical issues that exist in rural communities, such as the dual relationships and how to make these decisions to determine whether or not it is an ethical dilemma or not, or if their solution to the ethical dilemma is appropriate. One thing I do to make sure that I am making sure I am ethical is I will often, seek consultation. I will talk to a friend of mine. I usually talk to more than one person, and to make sure that I am making the best decision I can with the information that I have. So, the big thing is knowing that these things will come up and boundaries will be tested, and to know how you're going to navigate them appropriately. So some of the main takeaways for this episode that I really want you to focus on is that if you are a social worker in a rural community, you are not alone. We are here for you. I am here for you. I want to provide this resource. I want to come alongside you and help you navigate these. There are things that make the delivery of social work difficult. Those are the lack of access, the financial barriers, the stigma, the needing to have a more generalist approach so you can manage the crisis issues and any issues around the potential case management that may come up. Every rural community, although, is different. And my rural community may not be your rural community. So do take what I say with a grain of salt, and remember that it will vary in different rural communities because of how they function. My specific community is a farming community that is rural, which functions different than a community that is not a farming community. And that is okay. So, I think of like self-help books. It's a a la carte situation, right? You're going to take little pieces of each self-help book and find what works for you and leave what doesn't. You do not have to take everything, and that is okay. So same thing goes with this podcast. Take what works for you, leave what doesn't work, and remember that we are in this together. You're not going to hurt my feelings if you don't take my advice. And if you have better advice, I'd love to hear that. So please reach out. My main goal with this podcast is to build connection and foster a sense of community where it is sometimes lacking when working as a rural social worker. When in doubt with any ethical issue, dual relationship, or boundary, my recommendation is always to consult with a colleague that you trust, or even a couple, to make sure you're making the right decision. If you are interested in reading more about rural communities, I have 2 books in mind. The first one is Rural Social Work in the 21st Century, Serving Individuals, Families, and Communities in the Countryside by Michael Daly, which breaks down all the issues and challenges in rural communities and gives some guidance on how to navigate those. The second book is Social Work in Rural Communities by Leon Ginsberg, which also addresses the issues and challenges, but also looks at specific populations in rural communities as well. Both of these individuals have provided invaluable information in the field of social work specific to rural communities and would be a great resource for anyone wanting to read more about rural communities. There's so much about rural communities that I could go into in great detail, but this is just a little snippet of it. And I just want you to know that while there are challenges in rural communities, there are also a lot of benefits. And it is in our community, we live in a beautiful community, outdoors, having fun. There are a lot of positives. So just remember that when working in a rural community is that there's also positives along with those challenges and that you're not alone. If there are stories or issues that you face in your practice and you would like me to discuss those on this podcast, please send me a message at theruralsocialworker@gmail.com, and I will be happy to take a look. One of the goals of this podcast is storytelling, and I believe that to be impactful, you need context, and that is where stories come in. They give us something to work with and something to build on. I also believe that stories from multiple different rural communities will offer more information and provide more support to rural social workers everywhere. So with that said, I hope you enjoyed this episode and will subscribe for more.
joining me for another insightful episode of The Rural Social Worker. If you've enjoyed our exploration into the vital work of social work in rural communities, be sure to subscribe, share, and connect with me on social media. Your support helps me continue my mission of closing the gaps and fostering resilience in the places that often go unnoticed. Remember, this podcast is not a substitute for official supervision in your professional journey. Until next time, stay engaged, stay informed, and keep making a difference in rural communities.